This is Dr. Daniel Paul, orthopedic doc with Easy Orthopedics, and today we're going to talk about orthopedic injections, why are there so many, and which one's probably right for you. If you like this video, we put out new content weekly, so please like and subscribe. So, non-operative treatment in orthopedics, it's a lot of, there's physical therapy, other sorts of modalities, but there's a lot of injections, and why we do injections, we're just basically putting a really strong anti-inflammatory, for the most part, into the place where there's inflammation. We can decrease that inflammation. It allows you to do therapy, correct your biomechanics, and hopefully you don't need another injection. That's with some instances of it. Other instances of it, or it's like there's arthritis, it's wear and tear, and you might need a joint replacement, but this is a way for you to avoid getting a joint replacement at least for a while. So injections fall into, I'd say, I'm going to put it into about three major categories. The first one is steroid injections, and those are most commonly done. And again, just a really strong anti-inflammatory. Works really great for tendinitis, for bursitis, or like a trigger finger. Like in those instances, it can essentially be curative, right? Now, we also use it for arthritis, like someone has like missing cartilage in their knee, and that's going to be more of a band-aid. But again, it gives people relief for a while. Sometimes they go months or even years, so it's a worthwhile treatment that we do. There's a question of, do steroids inside a joint degrade the cartilage? And the literature is mixed. I think that it shows that at very high doses they do, but at medium to low doses it doesn't. So it's been a safe injection to really do in joints, assuming that you're not overloading it with too much lidocaine or too much steroid. So that would be the first category. Cheapest, most commonly used, onset of action. It takes about 2 days to start working. So for most things, you use that. The second category of injections, I would say, are sort of lubricant injections. This is your hyaluronic acid. These are more expensive. Insurance will still pay for them. They're only indicated mostly in the knee. I think in the hip and shoulder, it might still be off-label at this usage. They're significantly more expensive than steroids. Insurance will only pay for it after you've already tried steroids, but people find those generally work better. But again, a lot more expensive, and they're not indicated or used for quite every area. Some of them are just one shot. Those are the ones that I would use when I do them, which is not often. But more often than not, it's like a series of 3 injections. So that's the second category. The third category I'd put is regenerative medicine. Now, this is stuff like your PRP and stem cells, stuff that insurance does not pay for. The highest quality of those, I believe, is PRP. There's the most literature on it. And that can actually have some healing properties. Is it going to regrow all the cartilage in your knee? No, it's not. But for tennis elbow or other sorts of like tendinous partial injuries, there's some regenerative properties to it. Again, more expensive, probably around the same as like a lubricant injection or a little bit less. Onset of action is like at least a month, maxes out at 2 to 3 months. For a tendon, it can even be up to 6 months, like plantar fasciitis or like tennis elbow. So that's something that I do in my practice. And then there's other things that don't have as much literature, like stem cells. The only stem cells that are legal to use in the United States are stem cells that are taken from your own hip joint. Stem cells that come in the mail are not legal, even though companies will tell you that they are. They're submitted wrongly through the FDA pathways, and the FDA actually is cracking down on those. So I would not use those. Same thing with exosomes, amniotic jelly, Wharton's jelly, all that sort of stuff. That stuff may work. We just don't have the data to show that. And it has to go through drug trials in order to be on market for use because it's more than minimally manipulated. I'm kind of getting into the weeds here, but that's where it's at. And a lot of people just say, hey, it works, and they sell it for thousands of dollars when it's really not appropriate for them to do it. It's not something I would get injected on myself, but for PRP, yes, steroids, absolutely. So those are all the sort of different types of shots. I hope I was able to answer your questions about them. If you have any questions I didn't answer, feel free to leave them in the comments below. I'll do my best to respond, but I can't answer any specific questions about your condition because this video and all my videos are for educational purposes only. Thanks for watching.